G'day, Chris from the Headache and Pain Management Centre for another video for National Headache and Migraine Week. And today I'm answering the question that gets asked so much, either by Taylor on Facebook Messenger replying to your inquiries, on the internet or on the phone. This is the big question that we are asked, and that is, I've had my neck treated for my migraines before and it got worse. What does this mean and can you help me? So that's the answer that we're going to be giving you today to give you a bit of clarity around what needs to happen if that happens. So when you have treatment on your neck, okay, if it's a well-meaning massage therapist, physiotherapist, chiropractor, any of these ones, and when you get treated, the headache or migraines get worse, they flare up. What does it mean? Well, it can mean one of three different things. Okay, the first thing is that the technique was not the right one for you. Okay, so this is the case where you might have an issue with, the top couple of joints of your neck or even lower down in your neck. But what's happened is that the technique that's been applied, so whether it be a trigger point release, a muscle release, a joint mobilization, it might not be either the right technique for that joint particularly, or it's in the wrong direction. Okay, so instead of treating from left to right, it was treated right to left. There might have been a lateral flexion instead of rotation, or a bit of extension rather than flexion, something like that. So if it flares up in that situation, basically you just need to make sure that your therapist, your person that you're seeing, knows what has happened and can interpret the information, because quite often if there's a flare up in that situation, it gives more details and more data. So that's the first one, that the technique was not correct for what is going on. The second thing that can be the issue when you flare up after getting your neck treated is that your neck is too sensitive right now for the technique being applied. Now, I've been in this caper for a very long time now. I've seen all sorts of different migraine and headache presentations. And basically, it's always a little bit of a gamble on day one when you've never met somebody before, picking the right thing to do for the right person on day one. I've got a policy of being very conservative because I know what can happen if you do just the wrong thing for just the wrong patient. Now, what do I mean too sensitive for the technique being applied? Now, it's a reality, unfortunately, that for some people with headache and some people with migraine, that the neck and head are so sensitive that even touching the neck can be a problem. That might be you if you're watching this video, that touching the neck or doing anything with the neck can be too sensitive. In fact, there was a piece of research that was done recently which was assessing people with migraine in relation to the neck, and 30% of people couldn't even do the assessment because the assessment was a little bit too rough in that research stage. So it just goes to show that sometimes it can be just a little bit tetchy, a little bit touchy, a little bit sensitive. So if you found that there's a flare-up after getting your neck treated by a well-meaning therapist, it could well be that your neck is just a bit sensitive, and what needs to happen first is perhaps just a bit of active movement first, perhaps a little bit of a gentle stretch first. Perhaps it might even be treating lower down the neck first instead of specifically at the top of the neck. If you see someone who is an expert in treating headaches and migraines, they'll be able to know pretty quickly what would be the best for you based on the behaviour of your symptoms, your history, and what's worked for you in the past and what hasn't. So the second thing is, if you are too sensitive to have your neck touched at the moment, doing a different technique would be good for that. The third thing, of course, and probably the most obvious one, if you're flaring up if you are getting a neck treatment, and this is actually quite rare, but it is the most obvious one if you think about it, and that is that it is not your neck that's the problem, okay, that it's the wrong diagnosis. Now, we see many people through here at the Headache and Pain Management Centre with headaches and migraines, and quite often they come in without a doctor's referral. Okay, so people come in, they give us a call, we do a bit of a screening over the phone to see what might be happening, and by and large we are able to screen out those nasties that come through on the phone, whether it be a brand new issue with blood pressure or an intracranial thing, something happening which is not in the realms of physiotherapy. If you do present to a physiotherapist or a chiropractor and things don't go quite as planned, it's always good to consider if the diagnosis is actually the neck that's the issue. Perhaps it could be something like a functional neurological disorder where it's actually more the brain's wiring which is the issue, where headache and migraine is a secondary symptom. It could well be something like an autonomic nervous system dysfunction, or perhaps blood pressure, allergies, these sorts of things. But by the time they get to us, usually they've had their doctors check this out. But if there is any doubt, obviously you should go get that checked by the doctor. There are other things as well that can cause headache and migraine, viral things, concussive things, all sorts of different things that can cause these sorts of issues. Generally, these things don't come through our door because they've been assessed first. But if you're finding that things aren't improving or they're getting worse, it's always good to consider if there is something else is going on that is not the neck. So that is also a thing to consider. A really good thing to know though is that if you do flare up from a neck treatment with headache and migraine, by and large, it's those first two categories. It's the techniques that aren't quite right, or that your neck is just a bit sensitive for the technique or the touching of the neck to happen at that time. And there are other things that can be done to solve the problem with the neck, even if the technique is not quite right or things are a bit sensitive. The other thing to know as well is that it's actually very, very rare for any physical damage to happen when you get your neck treated by gentle mobilization, gentle muscle releases, or gentle massage. The exception, of course, is that teeny tiny risk of people that go when they're treating the neck, which is something that we don't personally do, but we do know that other manual therapists do that at times. But it is very, very rare. The complications from manual therapy are very rare from a physical perspective, and it's most likely to be an overly sensitized muscle or joint, or the technique is in just the wrong direction if something does go wrong. So if this is you, if you have had your neck treated before and things have gone not quite to plan, then it's a really good idea to get it assessed, a second opinion perhaps, from someone who does treat headache and migraine every single day, that knows what they're looking for, that knows the ins and outs of how the neck operates, and knows those differential diagnoses to know that if it's the neck or if it's something else. And of course, here at our clinic, my staff and I do see headache and migraine every single day. Migraines, headaches, cluster headaches, tension headaches, hormonal headaches, you name it, we see it. We know what we're looking for. We know what the signs need to be, and we know what we need to do should things go awry. So yeah, that's pretty much it for today's video for National Headache and Migraine Week. I hope that's been helpful. We'll be back tomorrow for another video talking about the neck and its relationship to headache and migraine, and how best to help you with your headache and migraine condition. Cheers and bye for now.